and we exist to try and address the shortages of staff at rural hospitals by investing in rural youth to study health science qualifications, and then on graduation they go back and work at a rural hospital. What we've been able to show is that young people are willing to work hard, they have the academic ability. We're taking youth from non-fee paying rural schools, they're going into universities and studying health science qualifications, which are difficult, and they are succeeding. We're getting a 92% year-on-year progression rate, and our students are competing better than the national average. So it gives me hope that there are young people who have the ability, and all we need to do is support them in their journey. So this young woman, I said to her, so who supports you? Because you're giving all day, every day of the week, and then you travel out to a clinic. And yeah, she was saying her family, she's not married, but her parents and siblings. But I think it's a critical thing. There are key players in the health care system that need support. And I once came across a medical doctor who had been in practice in a rural hospital for 15 years, and he's doing cataract surgery. And I happened to just come in on the day that he was screening patients for their lenses. And he said to me, I think my time's up. And I looked at him, I said, Henny, how can you say that? Because in front of him was this queue of gogos and babas, just all waiting for service. And he was doing it. And I said, Henny, you're restoring sight to the blind. If you were not here, what would happen to all these people? And it was a changing moment for him. So he's a well-qualified white man working in a rural hospital. But what I learned from that is people get tired. People get overwhelmed by the workload. And so they need support. They need some encouragement. They need someone at least to acknowledge the impact that they're having. So I think we can do a lot, just ordinary people, by encouraging those that are at the rock face, literally.
Rural Doctors Association in South Africa is it's an NGO. It's on a voluntary basis. So we've got one part-time secretary who looks after the office and the affairs, and then the rest of the executive is employed by other people who just have passion in rural healthcare. So the foundation started because there was a need for rural healthcare workers to network and to share best practices, to sort of come together when it was time to fight for a good cause, and then to be able to sort of pick up issues from within the departments or within rural spaces, and then advocate for those issues. And as a result, Rural Health Advocacy Project was also born. So RUDASA came into partnership with Section 27 and VET's Center for Rural Health to establish RAP, which is the advocacy wing for Rural Doctors Association. Then on top of that, we are partnering with a number of other organizations, for instance SAPA, which is advocating for fair alcohol use in the country, and we're partnering with Healer Project, so in the food sort of justice spaces, yeah. And then during COVID, we actually then got a fund to assist with buying certain equipment for rural hospitals. We assisted 4 hospitals, 2 in KZN and 2 in the Eastern Cape, with buying equipment to assist. So oxygen delivery equipment like your CPAP masks, and then making of your cloth masks and a number of other projects within those communities that we supported. One success story for us is being able to launch the RAMP project that I spoke about earlier. So RAMP is Rural Africa Mentorship Project, and as part of the RAMP project we're able to run an onboarding I would say lectures or training actually for junior staff that are coming to rural areas, in which case we are hoping that we capacitated young doctors and other healthcare workers actually for rural healthcare. We had actually very good feedback, and we covered numerous topics from the district health system, how to survive rural healthcare. Then we went into clinical scenarios as well, so bringing in HIV care, caring for your critically ill patient, bringing in maternal and child health as well. So I think that for the past year has been quite a great success for us. So Rudasa has also now branched into 3 other sort of sister organizations, if I can say, and those are RUNESA, which is the nurses organization, PACASA, which is the clinical association or clinical associates organization, and then RURISA, which is the Rehab South Africa Association. So yeah.
Yeah, this is very exciting today, because I think, we on a month-by-month basis, you get a whole host of proposals, you interact with beneficiary organizations, but you never really sit back and look at the sum total of what we've achieved. And today was a manifestation of, I suppose not what we've achieved, but what we've been able to facilitate great organizations to achieve in healthcare. We want to really create impact in communities. We want to strengthen the healthcare system, and I think most importantly we want to ensure that all South Africans ultimately have access to good healthcare. So that is for us an important issue. In order to do that, we need to understand what the needs are. So and in order to do that, we need to have a very clear mandate of what we can achieve through our funding, because we have a finite amount of money, and we want, because of impact, we want to ensure that that money is going to the right places and into the right causes, most importantly. So there are a couple of things that we do. On the one hand, we've got a very clear set of focus areas. Maternal and child health is one big focus area. Human resources for health, as you heard today through Mtombo, is a big focus area. And the third is broadly community health. So those are and we stick with that. And we have found the right alignment with organizations that deliver on that mandate. I think the fact that we have been engaged with these organizations for so many years is because we've seen the impact that they've made in their respective communities, which you also saw for yourself today. So, it's a no-brainer for us to be doing that, and we can kind of very confidently state that we have made some contribution to the broader kind of healthcare system, and particularly the public healthcare system within South Africa. And I think opportunities that go way beyond even them. So they become role models in their very communities. Young people coming through the schooling system, they see Dr. Lunge Hobe, they see Supermandla, they see all these people and they think that's what we could become as well. And so I think that on the one hand. On the other hand, if you look at the high youth unemployment rate in our country, what's it, 70%? Here are young people who, after years of study are actually employed. They are contributing to our economy. And so those are just the spin-offs that we see through our investment in these respective communities.
For more stories like these, go to www.social-tv.co.za. Subscribe to us on YouTube and follow us on our social mediums.